Utilizing counterstrain technique to treat posterior tender points. And in this case, we're going to show you a tender point called PC1 Inion, a posterior C1 tender point, which is a little counterintuitive because it's up here in the nuchal line, right midline, just below the inion there. So it's called PC1 Inion. And it might be a little left and just a little, or a little right off the midline, possibly. And what we simply do with this, again, might be counterintuitive to you because typically the posterior tender points, now which I'm getting with my left hand pushing straight up into it, is not to go backwards, but to actually fold the head forward and up and nod that head forward. And now I ask my patient if the tender point is alleviated or becoming less, so I might have to bring her up a little more or bring her back. And sometimes if it's shaded a little left or right, I can just do a little side bend, rotate away, and hold her there for 30 seconds. Give my left hand a little push on the tender point to recheck it. And if that's okay and I don't have to readjust, hold her for another 60 seconds, again for a total of 90 seconds. And then just bring it back slowly and back to neutral. And then with my bottom hand, push up on the tender point to make sure it's improved, hopefully.